Hey y'all, so I'm back today to talk about the topic of healthcare in Brazil because I am a licensed nurse in the United States of America, specializing in critical care. So of course, everywhere in the world that I go, I'm always interested in how their healthcare systems work, particularly in countries that say that they have universal health care. So I just thought I'd come here today to sort of explore this issue as it relates to Brazil. Before I begin, I have to put out a couple of disclaimers, okay? So the first one being that this video is going to talk about specifically Fortaleza as a city, because as most of you know, Brazil is a huge country just like the United States. So it's very difficult. Brazil has a similar problem as the United States in that it is very difficult to sort of make everything work in the same way in every state, in every region, okay? And the second thing is that this video focuses on the existence of these programs rather than convenience for all people, because that is another thing that we tend to get confused, I guess, when we're talking about things like universal care. A lot of people, for example, will incorrectly say that a thing is bad because it is inconvenient or imperfect. So I'm not really exploring that. My focus is universal health care, specifically in Fortaleza, Ceará, Brazil, and I am focusing on programs that exist rather than convenience for the entire population. Okay, so let us begin. So the first thing that surprised me about universal health care in Fortaleza was basically the scope of what they have available here. So for example, there are at least two major teaching hospitals here where basically anybody from the population can just go into those hospitals and receive a very wide range of basic health care. The more complex things, of course, you would have to go to a specialist, but with basic things like maternity care, basic health checkups, broken bones, like just stuff like that, like chronic illness, things like that. There is probably a hospital or a clinic somewhere in Fortaleza that can see you. Okay, so I was really shocked by that, especially by the two free teaching hospitals that they have here that basically just provide an extremely wide range of treatments and healthcare for the population. There are also a lot of quick care clinics here and medical posts, okay? So yeah, basically if you have a sprained ankle, if you've got a cold, if you have a chronic condition, if you need to get your teeth cleaned, like basic dental work, even basic dental surgery, like stuff like that. Yeah, like there's somewhere in this city that you can go and get that stuff done for free. Now, it's not always convenient because there is a very large poor population here, but as I said before, I'm not really focusing on convenience. I'm focusing on the existence and availability of these types of programs. This type of thing can be really difficult to find in the United States, especially now because, as most people know, this is a huge fight that we're having there. Basically that question of whether or not healthcare is a right or something that you only get if you're rich. The older that I get, the more I lean towards thinking that it should be a right, because obviously, having a healthier population it's just better for everyone. So another thing I wanted to talk about, I mentioned it before, but about their quick care clinics. Okay, so I've actually been to a couple of these with friends, and I was actually really impressed with how they function. They had an accurate triaging system, and the ones that I went to, of course there were people complaining because people who were not priorities, who were not emergent, they had to wait. So of course you have the thing where, if you've got a cut finger or something like that, or like a basic cold, but your vitals are stable, of course you're going to be in there for a while, But I did feel like the triaging system of the two that I have visited, I thought that they were actually pretty accurate. And they do, when people come in, they do take like a basic set of vitals. So there is somebody looking at you when you first come in to try to sort of assess like your baseline, and to try to see if you really need to wait or if you need to go and see the doctor immediately. So I was really impressed with that. So those clinics work in the same way that quick care clinics in the United States work, only at these clinics, you guessed it, you don't have to have any money to go into one right off the bat, So I thought that was really cool. I know that a lot of this great healthcare that they have in Fortaleza is due to the fact that their mayor, I think he got a master's degree at the University of Arizona, and I want to say that it was in health administration or something like that. So, obviously he is applying a lot of what he learned to his city. So I think that's pretty awesome. I have also been really impressed with the cost and availability of your basic medications like antibiotics and things like that. So yeah, that kind of thing can be a sore point for a lot of Americans. Once they have their diagnosis, then they're having to lose their homes because of meds. So because there are a few medical schools here, anybody that reads the paper will see that every couple of months, for example, you'll see ophthalmologists, for example, doing a free drive at the mall, just making free eye exams available to a wider range of the population. You will see them having drives to vaccinate children, and anything that you can think of. You see them occasionally. You'll see a group of healthcare workers showing up at a grocery store or at the beach to just do things like check people's blood pressure for free, or to check their blood sugars, things like that. So it is definitely more than what I have seen in the majority of states in the United States. So I can't help but to be impressed with it. You will also see that there is the availability of free surgery and access to treatment for more complex conditions like different types of cancers and things like that. The opposite is true here, however, in relation to insurance. So I was really kind of surprised to see how bad a lot of the insurance companies are. I mean, we thought they were bad in the United States, but here the ones that the majority of the people have real access to, that they're paying every month for, I was very surprised at how much stuff they just didn't want to treat. I mean, a lot, and a lot of people are paying a lot of money for this insurance. Here, it is, in my opinion, it is actually better to have money saved. Because when you go to have procedures done, like MRI scans and things like that, or go to have blood workups done, stuff like that, I see that for people that have money, that just have physical money that they can pay for things, everything is of course much more convenient, and prices here are much more accessible than they are in the United States. So basically here I waffle with the idea of having private insurance versus just saving all of that money, and if I ever needed it, just using that physical money to get me through the healthcare system. Because as well, their healthcare system as well just sort of requires that you know people that can help you navigate it, you know. So yeah, for me, I think yeah, like just save money and just use, you know, like just get a friend to help me to navigate through the system if I ever needed it, you know. So yeah, those are the main things that I wanted to sort of touch on about healthcare in Brazil, with a specific focus on the city of Fortaleza. And as I've said before, this doesn't apply to every single place. I know that there are a lot of poor counties around the country that don't even have doctors, so you know, I'm really aware of that. But in this particular city, I think that it works pretty well. I've been really impressed, and I just keep seeing it get better. So, you know, if you're ever around these parts and you need some work done, I think Fortaleza might be a place for you to visit. All right, y'all. Have a good day, and I'll holla at you soon. Deuces.